Hi, I'm Dr. Paul Betts with the Betts Clinic here in Jonesboro, and I want to talk with you today about 5 signs that you should not ignore if you have back pain. Let's admit it, as adults, we've all faced back pain at some point or another. Back pain really makes you think that you're getting old. While a lot of people think that back pain is normal and it should be ignored, I'm here to tell you otherwise. If you've ever experienced back pain, then it could be a sign of something more serious. Back pain is pretty common with our generation. After all, we're all hunched over in couches and on chairs while watching our favorite TV shows or movies. The American Chiropractic Association says that 80% of Americans will experience back pain at some point in their life. Another surprising fact is that women are more likely to experience back pain than men. They're also more likely to ignore it and kind of sweep it away under the rug. Women tend to put their healthcare needs at the bottom of their priority list. However, men, on the other side, are more intolerant to pain, and we usually get checked with even the slightest muscle cramp. So while ignorance may be bliss in some cases, that's not true when it comes to back pain. The truth is, sitting around ignoring it or even masking it with pain medication or just waiting for it to go away may even make it permanent and worsen the situation. So as a guideline, there are 5 specific signs that if you experience these, you should definitely get your back pain checked out. First, if you're experiencing a strip of pain that radiates from your back, down your leg, or even into the foot, then you might be facing some nerve irritation. You should definitely get it checked immediately because it might not go away on its own and it might lead to worsening pain. The longer you wait, the more treatments that you're likely going to need to get that corrected. So don't worry, the patients that do come in to see us with this type of nerve irritation, they usually don't need surgery. In fact, 90% of them get treated non-invasively with non-invasive methods like therapy or rehab exercises, heat, stretching, laser, even spinal decompression. So the second sign, if your leg is hurting and making you limp, then you should definitely get checked out by a chiropractor as soon as possible. That limping, it could also become permanent if you ignore it. So definitely be better safe than sorry. The third sign you should watch out for is urinary incontinence. And this is basically when you have numbness in the groin area. So urinary incontinence is a term that we give to the state where you really don't have full control over your bladder. You're putting in a conscious effort to control it, but you're not really controlling it. So these could be symptoms of cauda equina syndrome, which is something that's a lot more serious and which means that the nerves at the bottom of your spinal cord are being compressed. The treatment for cauda equina syndrome is immediate surgery because if it's done too late, you may not fully recover. So therefore, you should always get yourself checked by a chiropractor immediately if you're facing these types of symptoms. Now, the fourth sign that you should definitely get checked out is if you have chills, fever, or night sweats all over the body. This could be your body's way of showing that it's in a lot of pain and that your spine's out of alignment, but it could also be something more serious. So you definitely want to get that checked out. The fifth and final symptom that I want to tell you about is an imbalance with pain. This is especially common with women. As women become older, they also develop an increased risk for osteoporosis. And of course, osteoporosis is when the bones are weaker to the extent that they could actually get fractured a lot easier than when they were younger. So this is why older women, oftentimes when they fall, they could break a hip or break a wrist. So if you're finding yourself unable to balance yourself properly and you're feeling pain in your back, then you should definitely get yourself checked as soon as possible. So in the end, I'd like to say that even though cancer is definitely at the bottom of this list when you hear these signs and symptoms of back pain, you should still get yourself checked as soon as you can. So thanks for watching this video, and please share it. I welcome any comments or questions at the bottom, and be well.